Presenting another informational video by Diabetic Supply. This video will go over everything you need to know about Trelegy Inhaler to get started using it. 1. What is COPD, and how does Trelegy help manage its symptoms? COPD stands for chronic obstructive pulmonary disease, a progressive lung disease that makes it difficult to breathe. It is caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. COPD can cause symptoms such as shortness of breath, coughing, and wheezing. Trelegy is a medication used to manage COPD symptoms by combining 3 different active ingredients: fluticasone furoate, umeclidinium, and vilanterol. Fluticasone furoate is a corticosteroid that helps reduce inflammation in the airways. Umeclidinium is an anticholinergic that helps relax the muscles around the airways, making it easier to breathe. Vilanterol is a long-acting beta agonist that helps keep the airways open. Together, these 3 active ingredients work to reduce inflammation, relax the muscles around the airways, and keep the airways open, helping to manage COPD symptoms such as shortness of breath, coughing, and wheezing. Trelegy is delivered via an inhaler and is typically used once a day. It is important to use Trelegy as prescribed by a healthcare provider and to work closely with them to monitor its effectiveness and adjust dosage as needed. 2. How should I use Trelegy Inhaler? What should I do if I miss a dose? Trelegy is delivered via an inhaler and should be used as prescribed by a healthcare provider. Typically, it is used once a day at the same time each day. To use the Trelegy Inhaler, remove the cap, shake the inhaler for 5 seconds, exhale fully, and then place the mouthpiece in your mouth and inhale deeply. Hold your breath for at least 3 to 4 seconds, and then exhale slowly. If you miss a dose of Trelegy, take it as soon as you remember. However, if it is close to the time for your next dose, skip the missed dose and resume your regular dosing schedule. Do not take a double dose to make up for a missed dose. If you have any concerns or questions about how to use Trelegy Inhaler or what to do if you miss a dose, consult proper professional. 3. What lifestyle changes can I make to help manage my COPD symptoms in conjunction with using Trelegy? Making certain lifestyle changes can help manage COPD symptoms in conjunction with using Trelegy. Some of the recommended changes include: quitting smoking. Smoking is a significant cause of COPD, and quitting smoking is one of the most effective ways to manage COPD symptoms. Avoiding triggers. Identify and avoid any environmental or occupational triggers that can worsen COPD symptoms, such as pollution, dust, and fumes. Engaging in regular exercise. Regular exercise can improve lung function and overall health. So develop an exercise plan that is safe and appropriate for you. Eating a healthy diet. Eating a healthy and balanced diet, including fruits, vegetables, whole grains, and lean protein, can help support overall health and lung function. Staying up to date on vaccinations. Staying up to date on vaccinations such as flu and pneumonia vaccines can help prevent infections that can worsen COPD symptoms. It is important to note that these lifestyle changes are not a substitute for medical treatment, and you should develop a comprehensive treatment plan that includes medication, lifestyle modifications, and ongoing monitoring of your COPD symptoms. 4. What are the potential side effects of Trelegy? What should I do if I experience them? Like all medications, Trelegy can cause potential side effects. Some of the most common side effects of Trelegy include headache, cough, sore throat, nausea, and viral infections such as the common cold. Other possible side effects include increased blood pressure, pneumonia, and osteoporosis. If you experience any side effects while taking Trelegy, it is important to consult a professional. Depending on the severity and type of side effect, you may need to adjust your dosage, switch you to a different medication, or recommend additional treatment. It is important not to stop taking Trelegy or adjust your dosage without consulting your doctor, as this can lead to worsening of COPD symptoms. If you experience a severe or life-threatening side effect, seek immediate medical attention. 5. Are there any other medications, supplements, or activities that could interact with Trelegy, and should I avoid them? Yes, there are several medications, supplements, and activities that could potentially interact with Trelegy, and it is important to speak with your doctor before starting any new medications or supplements while taking Trelegy. Some medications that can interact with Trelegy include beta blockers, other medications containing long-acting beta agonists or anticholinergics, and certain antibiotics and antiviral medications. Certain supplements, such as St. John's wort and some herbal remedies, can also interact with Trelegy and should be avoided unless approved. It is also important to avoid certain activities that can worsen COPD symptoms, such as exposure to environmental irritants, like pollution and cigarette smoke, as well as activities that can strain the respiratory system, such as vigorous exercise or excessive talking. Always consult before starting or stopping any medications, supplements, or activities while taking Trelegy or any other medication for COPD. 6. How do I know if my COPD symptoms are getting worse, and what should I do if I experience an exacerbation? It is important to monitor your COPD symptoms regularly, as worsening symptoms can indicate an exacerbation or flare-up of the condition. Some signs that your COPD symptoms may be getting worse include increased coughing, wheezing, shortness of breath, and mucus production. If you experience an exacerbation, it is important to take action quickly to prevent further complications. Your professional may recommend a specific action plan, but generally, you should increase your use of rescue inhalers. Continue to take your regular medication, and rest as much as possible. It is important to work closely with your doctor to develop a personalized COPD management plan that includes regular monitoring of your symptoms and specific steps to take in the event of an exacerbation. 7. How frequently should I see my healthcare provider for checkups and monitoring of my COPD symptoms and medication dosages? The frequency of checkups and monitoring for COPD symptoms and medication dosages can vary depending on the severity of your condition and your individual treatment plan. However, it is generally recommended that individuals with COPD see them at least once a year for routine checkups and monitoring of their symptoms and medication dosages. If your COPD symptoms are more severe or if you experience frequent exacerbations, they may recommend more frequent checkups and monitoring. It is important to keep all scheduled appointments and to communicate any changes in your symptoms or medication use between appointments. Thank you. Visit iBuyDiabeticSupply.com for your extra supplies.